That you in an African malaria clinic. A mother just walked in, exhausted from out of walking. Her child has a fever. She could wait for the blood test from the doctor to confirm this is malaria and buy a treatment for it, but that means several weeks worth of wages and several trips back to the clinic. Or she could wait. Her odds are pretty bad. Every 2 minutes, a child dies from malaria. The traditional malaria test is labor-intensive, time-consuming, it requires blood tests and a professional analysis. Now, for the first time, the malaria diagnostics test can be administered at home.
Hey everyone, my name is Mohammed Abdurrahman, and I'm going to be talking about our client needs and our end user. So who is our client? We were asked by the directors of WPI to create an affordable imaging device that can be used to diagnose malaria, be easy to use, and the device must be able to be used without the need of constant electricity. However, this device wasn't meant for the directors at WPI. We intended this device to be used for people of all ages, and we targeted specifically people in Nigeria where malaria cases and malaria-related deaths are number one according to the World Health Organization. This device, in simplicity, can be used by both healthcare professionals on suspecting patients and by the patients themselves.
The device itself looks and functions similar to a pregnancy test, in that the user deposits their saliva through the receptacle at one end of the device, then immediately exposes it to UV light. In practice, this would mean leaving the device in the sun for around 30 minutes after depositing the saliva. During this period, the saliva will travel up the pad from the receptacle and fluoresce under the UV light, displaying the results. The user can then view these results after the exposure by looking at the test pad, where either 1 or 2 bands will appear, corresponding to a negative or a positive test, respectively.
In theory, the test functions much like a pregnancy test. The user spits on the pad, after which the saliva travels up the pad, passing 2 key checkpoints. The first control line is to check for immunoglobulin G, and should appear fluorescent for every test. The second test line specifically looks for the PSSP17 protein, and will only fluoresce if the protein is present. This is achieved through creation of recombinant antibodies for the protein, followed by conjugation or fusion of the antibody with a microparticle. The fused product, when exposed to UV light, appears fluorescent, allowing for the test to be analyzed. Looking at the first 2 bands in this graphic, we can see this theory in practice. With a negative control, only the first line is visible, while with a positive or malarial control, both the first and the test line are visible, indicating the presence of PSSP17, a protein linked directly to malaria.
The test itself will have a price point of $5 US, comparable to most at-home pregnancy tests. In the event of a cloudy day, the user can head to their nearest clinic to have their sample activated with artificial UV light. Although this test may not be a complete substitute for traditional blood-based methods, this easy at-home test has the potential to significantly reduce the pool of candidates who need their blood samples analyzed in a clinical lab setting. This will reduce the workload for clinicians and get information out to patients faster. Thank you for watching this video. Please like and share.